So, Bret, introduce yourself, since my audience does not know you.
Hello, my name is Bret Rogers. I am a acupuncturist in Austin and San Antonio. And this is Blue. She's with me today.
So, you wanted to talk about referrals, and I think more so referring out as an acupuncturist?
Yeah, sort of referring out and how to build a network, right, of people that you refer to, and why we would refer to each other.
Yeah. So I'm more familiar of my industry and massage than I am with acupuncture. I thought that it would be an interesting conversation to go over some of the comparisons and contrasts between the two. But what comes to mind for you when you're dealing with these subjects? In other words, what do you want to talk about in the beginning?
With referrals?
Yeah.
Yeah. I think, especially in Chinese medicine, we learn Tui Na, and we learn, there's lots of different Asian body therapies, right? There's the AOBTA, which I'm a member of, the American Organization for Body Therapies of Asia.
Yeah.
Right, and sort of with that certification, sort of the idea is that you're allowed to incorporate Tui Na or Thai massage, shiatsu into some of your treatments, and then we also do cupping, right, which lots of massage therapists are doing now. And so there's a lot of overlap between the two. Mm-hmm. Excuse me. And there's a lot of overlap between the two, and I think a lot of times... camera. Where I think that people are hesitant to, acupuncturists I think are sometimes a little hesitant to refer to massage therapists. Mm-hmm. And I think a lot of massage therapists don't even really know a lot about acupuncture.
I would generally say that's the case. Yeah. It's certainly, from what I understand about core curriculum in Texas, a lot of massage therapists aren't taught. I can't think of an instance where massage therapists are referring out to acupuncturists. It's more so they're talking about doctors or physical therapists.
Mm-hmm. And I think there's a little more of issues in the acupuncture community. So, right, we get a little sensitive about people trying to hone in on what we think of as our scope of practice. Yeah. And I think some people are very sort of resentful that massage therapists are starting to pick up cupping. Mm-hmm. And chiropractors doing dry needling, PTs doing dry needling. What else is there? The thing I really wanted to talk about was sort of MDs, PTs can get weekend certifications. And they're not weekend certifications. Some of them are a little longer. Yeah. But when that becomes dangerous in Canada, it was a massage therapist actually who did a seminar to do acupuncture because Canada at this time did not regulate acupuncture. And he was treating an Olympic athlete in his massage practice and convinced her to try acupuncture, and he gave her a pneumothorax, and she lost 40% of her lung function and wasn't able to compete in the Olympics. Yeah. Right? So I think it's important to know the differences between dry needling and stuff like that and acupuncture, right? Acupuncture's a longer process. We have a lot more training. It's pretty... I don't know that I want to talk about this. Now that I brought it all up.
No, but it's just giving people the basics. In other words, we don't have to go into great detail about it. Right. It's just, as far as, dry needling is concerned, it sounds like you can go in and take a weekend seminar in some instances. And then that's not the same as going through, you went through a 4 or 5 year training program. Mm-hmm. Yeah. Yeah. Just a huge difference, in what you studied, learned, what's safe, what's not. Yeah. And then treatment protocols for various, conditions.
Right. And then, sort of what you can treat, right? Yeah. Because dry needling is very much just sort of for like muscle strain, right? Like trigger point. And that was sort of one of the arguments at the beginning was like, well, we're not doing acupuncture, so we're calling it dry needling because it's only treating this. And then I've seen a couple of PTs and chiropractors like advertising dry needling for stress management and gastrointestinal disorders. And I'm like, okay, except now you are doing acupuncture.
Yeah.
But, you know, so at the same time, like I don't know how much... She's going to go get him. Look. Hi. Or are there people out there? There are. Sit. Hey. Hey. Good girl. Good girl. Stop it.
Blue in the middle of interview.
Mm-hmm. She had something to say. I think she agrees with me. Scope of practice is not, like, I'm not super upset about it. Like, it's neither here nor there. What we really need to make sure is that, like, people who are doing the work they're doing are adequately trained so that you don't hurt anybody.
Yeah.
And I've seen that happen with cups, right? Like, if you do too much cupping over the same spot too frequently, you can cause some pretty severe injuries. I've seen necrotic tissue, you know? So, but other than that, like, general scope of practice, like, if massage therapists want to do cupping, like, that's great. More people trying more things. If you're a good practitioner, people are going to come see you.
Well, it's also having massage therapists understand when it's appropriate to use cups. That's why they need acupuncturists like you to be able to train and educate them about, okay, people are having muscle issues. This is a perfect way that you can use cupping in your session for these specific issues. What I don't know is, because it's not my specialty, I haven't done enough research on it to know, you know, when massage therapists should use it. My students, for instance, I don't incorporate cupping. Mm-hmm. The reason why is not because I'm against it. It's just because it's out of my training. Like, I haven't studied that. Students have asked me when I talk about reboot sessions, these long sessions I do, could I incorporate cupping? And I tell them, one, I've not studied it, so I don't know. Two, if you want to incorporate it, I don't have any issues with cupping at all. I think it's a great adjunct, like, therapy that you can add in. It's just, it's not something I'm going to start teaching because I don't know it. You know, I'd have to get you to come into my curriculum and lay out, okay, what do we do with cupping in a reboot session? That's more how I do things, because there's only so many things I can specialize in. Yeah. I can't know it all. Mm-hmm. You know?
Yeah, and I think in general, any sort of muscle strain, right, is going to be, like, cupping's going to be great for that. Anything acute, as long as it's not, like, super inflamed. Within Chinese medicine, we actually use cupping for many other things. We use it to clear, at the beginning of a cold, you can get cupping or gua sha. So gua sha is, for those of you who don't know, it's similar modality to cupping, except, like, you're using, like, a tool to scrape, right? And I forget what it's like. I forget what it's called, but they're coming out all the time. All of these, like, fancy scraping tools, like the tooth or teeth, shark tooth. I don't remember, but I see them all the time. People are like, these brand new things, and I'm like, oh, that's cool. Yeah. It's very old, but I love. Like, I actually, one of my students, when I was supervising clinic at one of the schools here, had one of those, and it's actually really cool. It looks like a knife, and it has, like, lots of different edges, and you can get into fun places. It looks a little scary, though. I use a little teardrop-shaped metal device. Yeah. But so it's just like cupping, except, like, you're pressing down. Right, and I think, like, that's the sort of the main difference with cupping and massage is that, like, you're lifting up rather than pressing down. And for some people, that feels a lot better. And for some people, it does not. Like, I sometimes get a little sensitive when I get cupped. And I think, like, that leads into another part of the conversation that I think is really interesting, which is about, like, these different modalities work differently for different people.
Yeah.
Right? some people respond really well to chiropractic. Some people respond really well to acupuncture, Chinese medicine. Some people love really deep tissue work. Some people hate it. Some people love cupping. Some people hate it. And then the worst part is like people who don't like deep pressure, their bodies respond well to it. Do you find that a lot? I find that I have a fair amount of patients that they don't want intense work, but intense work gets them better results.
It's variable. When I talk about compression in my work, which I'm a fan of, people always thought I was talking about pounds per square inch, and I had to refine some of my language to the fact that it was like long-term holds and like skin stretching. Because it wasn't just like how much pressure I'm applying, it was like holding a spot and then hanging out for a while to allow their nervous system to respond to that input. That's different, right?
Yeah.
It's also something where I don't think that people come to see me if they're not looking for something with deeper pressure. I have a handful of clients who'll come in for a relaxation session that is 3 hours, but very rarely. Most of the people I work with are having some degree of chronic pain, and I'm usually trying to get them over the hump so they can just go to maintenance. It's not something where I just try to keep them coming in again and again.
Right.
Just because I felt like it was a better use of my time and my skills to work on people who are having chronic pain problems.
Oh, here we go. We're back. Hi, honey. Well, so that we've had this conversation before, though not here with y'all. So maybe now would be a good time to bring it up.
Yeah.
Science-based.
Yeah.
We have lots of really wonderful conversations about that. And so what I was just thinking there was like, one of the big things in this medicine is like a practitioner, right? Like a massage therapist. Like you can tell when you go get a massage, someone who has what I think we kind of casually refer to as the touch, right? Like someone who can like touch your body and work with it and get a healing response, versus someone who's a little more, I'm not sure if it's sterile is the right word, but it doesn't feel as healing.
Yeah.
Right? And how do you measure that? Like, how do you measure the competency of a practitioner within a scientific framework?
The research is more challenging to begin with. There's too many, unfortunately, it feels like there's too many variables. It's much harder to isolate a single variable to be able to do good research. Would be my guess.
Well, but I think like I think that's one of the problems, are ideas of like isolating a single variable.
Yeah.
Right? Like no variables exist in isolation. So why do we try and study them that way? I mean, that's where pharmaceuticals came from, right? We looked at herbal medicine, we looked at like the active constituent that did the thing, and then we took that out and made that into a medicine, right? Whereas all the other things around it, all the other herbal constituents, might be acting to mitigate some of the side effects that we see in the pharmaceuticals. So that's why a lot of times herbal medicine can be more holistic, can be less hard on the system, right? But it is not as potent, so it takes longer to work, which is why people get frustrated, because they just want something that works right now.
Yeah.
But that's a tangent. So when you were talking about like your
Prolonged skin stretch.
right, like compressions.
Yeah, that's what I call it. It's just compression.
So when we're talking about compressions, there's so many variables that even go into a compression, right? And like I've had that work. It's incredible. I love it. But how, like being able to measure that scientifically to understand like what's happening. You know, like maybe you could just put like a weight on someone.
Yeah.
Right? But then that doesn't like take into account, like if you're doing a compression with your elbow and you like change the angle and it gets deeper and it goes into it, and the practitioner's ability to know which part of the muscle is like extra tight. So that, all of this is to say, I think I hear a lot of times people bashing any sort of science that isn't, any sort of modality that you can't do like double-blind studies of.
Yeah.
or isolate a variable.
The thing is, I think that you can. I'm just saying that it's more challenging. And the more challenging it is, it makes the scientific research that much more complex and complicated. The other, I think, challenge that we have as people in our field, I mean, because I think both of what we're doing, acupuncture and massage, I think they're difficult to do research on. I'm not saying it's impossible, I'm saying it's more challenging. It's much easier to do research on OxyContin.
Right.
And go, what does this do? Because it's a single chemical compound, it's titrated down to a certain dose.
They had to isolate it out originally, so they had to do a process to get there.
Yeah.
You know, which they could do like let's say compression,
Sure.
right? Like you just take away.
But they can't patent, mass produce, and do what we do. That's where with massage, like with students, one of the reasons I'm okay with making video content and teaching students how to do what I do is I can probably only teach about 75% of it online. There's so much nuance that relates to me interacting with you and how I press or where I press, the timing, there's so much artistry involved that I can give away 75% without fear that people are going to steal something.
Right.
It's like, because they really have to use it. They really have to use their own bodies, their own body weight. They have to kind of feel it out as an artist. It's like me saying, okay, here's a palette, here's some paints and a canvas. They're not going to be able to just be a great painter,
right? Like Bob Ross,
yeah, overnight.
Right? Like I watch Bob Ross, I follow along, and mine does not look like that.
But that's it just takes practice.
Yeah. So
I'm very pro research and I'm very pro science. I think that science as a method of inquiry is amazing. And I think that it allows us to get to a more fundamental scientific truth about what happens. Because essentially, if you apply it to your field and you apply it to my field, what you do is you wind up getting rid of things that aren't the case. But it doesn't mean that the research stops. Science as a method of inquiry, it allows us to continue questioning what we do to refine it.
Right. Well, and even refining our method of inquiry, right? So that's where we're coming up with evidence-based medicine, right? Are you familiar?
I know the term, but yeah.
Right. So especially within acupuncture, like we're looking at evidence-based medicine, where they do these double-blind studies. They perform acupuncture. They do sham acupuncture, and they're like, oh, there's not a significant difference, so they're the same. But then, like when you look in the real world, you just have person after person being like, no, I had dramatic results from acupuncture. And people with like Bell's palsy, with like paralysis that has changed. Not just sort of like these like subjective, like, oh, my back pain's gone. Yeah. No, my paralysis is much better. So the idea is that we look at evidence-based, right? Rather than like trying to do this double-blind study. Because the problem there is like, what is sham acupuncture? Did you have an acupuncturist making sure that the points that you were doing on the sham acupuncture were not acupuncture points? And then how did you activate the points? I think one of the old studies that everyone always cites, they used a guide tube with a toothpick, right? Mm-hmm. But there are non-insertive techniques. You're still activating that point, right? And plus the practitioner's ability to engage and work with the chi and the channel. Again, like all of that is really hard to measure within our research. So what we're seeing now is a move towards evidence-based, right? People just looking at evidence rather than trying to create these double-blind studies. And I think what we're noticing now is that the things we're getting into, our method of inquiry isn't working anymore. We have to change the way we do research. And that's where we're at. Because if we do research the same way we've done research for the past 50 years, then how is science different than any other, like, dogmatic religion that says we do things the same way we've done it for centuries?
The way that I see it, and I'm not always, like, I was a philosophy student, but I didn't get too much into, like, the philosophy of science. I don't think of science itself as being, like, a religious framework. Science, to me,
it's a belief
that's
system.
why I'll call it as a method of inquiry. See, I don't think it's a belief system. I think it's a method of inquiry.
Okay.
So the thing is like, a good scientist doesn't just negate acupuncture. A good scientist applies scientific techniques to try to figure out what's going on, what is this?
Right.
And then at a point, a good scientist has to go, wow, it's difficult to like isolate variables. Like how do we isolate variables to do more authentic research when we have multiple variables? And that's, I think, a little bit more where you're maybe getting towards evidence-based.
Right.
Because there's a lot of things in both of our industries that I don't think are extremely well researched. You know?
Because
so when you talk about gua sha, there's Graston, which is, I think, a more trademark technique. Mm-hmm. And the thing is, it's applied and given some degree of notoriety.
Just a moment. I think you gotta go. I think you gotta go. I think you gotta go. No, I think you gotta go out this way. I think you gotta go.
So I'll just pick it up with Graston because I can cut it there. So Graston, to my knowledge, is like a trademarked kind of work. I think maybe only chiropractors can use it. I'm not sure. But Graston is very similar to gua sha. But when I hear people talk about Graston, it's like, ooh. And it's like, it's the same stuff. Like mostly, I think. I don't think it's that, has that much of a difference between gua sha. But if you put like a trademarked American name on it, that brand has a little bit more respect somehow. What I don't know is, I don't know how much research has been done on that sort of work. And that's just like another like small area. It's not just acupuncture. It's like an interrelated thing that's shared between massage and acupuncture. What I'm generally trying to explain to massage therapists is that I'm pro-science. Is I think that the research can continue. And when you talk about evidence-based medicine, it's also the reason for it, in addition, like scope of practice is to protect people. The reason I'm pro-science is because I want people to get the best pain management treatments they can. That's really the fundamental thing, is like we're preventing harm and helping people. If I can do both of those things, that's why I'm science-based, is because I feel like looking towards that allows me to get a little bit closer to whatever people might consider truth. And that also does include questioning the actual science itself, the research studies, how is it done, is it evidence-based, what are they considering as far as factors?
Yeah.
So, I guess I'm sort of an apologist for science. When people talk about it as a belief system, I get kind of, because I always think of it as more like a method of inquiry. Applying science allows us to question how things are done, to examine. Like a scientist should feel good when their hypothesis is proven wrong.
Well, I mean, I think now we're getting very much into the philosophy of it, right? Because I think you can find a lot of scientists online who are extremely dogmatic, and who think massage and acupuncture are total shams, and that this is all quack medicine, and they're the science shows, and they're very much science. So in that way, you have the same sort of trouble that you have with sort of religious dogmatists. Mm-hmm. These people who become so inflexible in their beliefs that they can't change.
Yeah.
And that and in and of itself, science should never be that. But also, most world religions preach love and acceptance about everyone, so they should also not be like that. And yet people everywhere are like that. So, I mean, I guess there are terrible people in every field.
This is true.
And they kind of can make a bad name for everybody else. Right? Especially there are acupuncturists in my field who are so in the air, floating around, very maybe ungrounded, might be a word to describe them. And when you try and talk to them about any of this stuff, they are just oh, I don't know. And I feel like people like that kind of give me a bad name. give acupuncture a bad name.
Yeah.
So what I'm saying is, like, there are scientists out there that I think give science a bad name, but I don't think, like, we should necessarily, like, blame the science, but we should acknowledge that science is kind of in the same realm.
Yeah. Well, I think it gets to the point where the Canadian who did the needle work and hurt the person, it's like that starts to become glommed on to what you do, even though you're like, no, that's not the same thing.
Yeah, most acupuncture-related injuries are caused by MDs in the United States. Right.
According to science.
Right.
Actual research studies. Wow, that's amazing.
Yeah, and so, like, I mean, I've seen articles where people, where, like, Western doctors are like, acupuncture is dangerous, here are the statistics, and it's like, okay, well, except none of that was performed by acupuncturists.
Yeah.
So definitely untrained people doing bad medicine is dangerous.
Yeah.
But again, you can't say that is acupuncturists.
Yeah.
Hold on, I'm going to check on Blue.
Okay. I'm going to pause the camera.